I'm Tabitha. I'm a 34-year-old mother of identical twin girls. They are 6 months old, and they're keeping me very busy. I was about 10 weeks into my pregnancy and wasn't feeling well. I had a bit of spotting, so I went to my general practitioner. They confirmed that I was pregnant and scheduled in some additional tests, including an ultrasound. That's when I learned I was having twins. My GP sent me to a high-risk clinic for the rest of my pregnancy. I had to visit the clinic many times over the next few months. I was put on bed rest 6 months into my pregnancy. That was really stressful because I couldn't exercise or prepare for the arrival of my babies. As my pregnancy progressed, I saw the physician every week to ensure both myself and the babies were okay. My partner and I were excited, but I was really stressed and anxious about the birth and how I would manage once the babies arrived. At around 36 weeks, I was admitted to the hospital for delivery. I received excellent care in the maternity ward. A fetal monitor was used to track progress, and after about 23 hours of labor and a complete shift change of nurses, they decided to do a C-section. Things got complicated during delivery when the babies shifted positions. The baby that was expected first had to be delivered second. She wasn't responsive, and I was bleeding a lot. I found out later that I had a postpartum hemorrhage. After my delivery, I spent a week in the hospital. I was on oxygen for a while, had regular blood work and wound care, and learned how to breastfeed 2 babies. Since my surgery, I find it really difficult to get up and down the stairs, but I've started getting out of the house and walking a little. I don't think my friends really understand what I am going through, and we don't have any family support here in town. As a new mother who spends so much time home while my partner works, I feel a bit lonely and disconnected from life.
Hi, my name is Robert and I am a social worker. Before a patient gives birth, I conduct holistic assessments to check for health and safety risks. I also help plan hospital discharges, which involves assessing the patient's situation at home. In particular, I focus on the mother's overall support structure, including family or home support, natural supports like friends and community, the current living situation and finances, the parenting history and attachment aspects, and the history of previous services. I then assess cognitive capacity and mental status, religious and spiritual influences, any special needs the infants might have, the mother's access to respite and childcare, as well as goals and motivation levels, including levels of optimism and openness to services. I also assess for mental health issues and personal trauma, including suicidal ideation and self-harm history of the mother and partner, the mother's history of thoughts of harm to others, mental health and substance use, history of parents and extended family, history of trauma and violence, adverse childhood events, previous grief and loss, family history of postpartum depression, prenatal and current health needs of the mother and infants, and the mother's personal strengths. In some cases, I take all this information and make referrals to community support groups. After I complete my assessments, I help coordinate post-discharge appointments before the mother leaves the hospital. These can include ongoing and home visits and additional supports and parenting assessments or talking to a community-based social worker.
My name is Alex, and I am a medical laboratory technologist. 2 to 3 months into a mother's pregnancy, an initial ABO-RH type and antibody screen is performed. As part of the prenatal workup, additional tests are done, which include hepatitis B antigen, syphilis serology, varicella and rubella immunity, and HIV serology. Swabs are also taken to test for certain sexually transmitted diseases. Our role as an MLT is to also do routine lab testing as part of a patient's regular checkup. The chemistry department will analyze body fluids such as urine and blood. Technologists will run tests for a wide number of body analytes, the most common being glucose, sodium, and potassium. Complete blood counts and abnormal cell analysis are done in hematology. The microbiology department will explore sources of infection such as bacteria or viruses and help the physician with proper treatment. Prior to any surgery, blood work such as a CBC and type and screen are performed to assess for anemia and prepare for a possible blood transfusion. The type and screen is twofold. It determines the Rh of an individual and then screens for unexpected blood group antibodies. In the case of pregnancy, the screen focuses on detecting antibodies the mother may have against the baby's blood group antigens. Once the type and screen is complete, appropriate blood products are matched to the patient and used if needed. The technologist makes sure there is an adequate supply of required blood components such as packed red blood cells, platelets, and plasma. In Tabitha's case, a transfusion was required due to her postpartum hemorrhage. The decision to transfuse red blood cells is based on decreased oxygen carrying capacity. In Tabitha's case, there was a lot of blood loss, so we needed to perform a red cell transfusion. Tabitha had 4 units transfused and was put on oxygen for several days post-delivery. Post-surgery, we conducted routine lab work to monitor results. This included reviewing the patient's hemoglobin level, which was a critical value of 40 grams per liter post-hemorrhage and prior to transfusion. After Tabitha's delivery, the cord and placenta were sent to the anatomical pathology department, where MLTs examine and study diseased tissue. If there is an abnormal pregnancy or delivery, both the cord and placenta will be measured and weighed while looking for abnormalities such as knots in the cord or hemorrhaging. The tissues are then cut into sections for processing, embedding, staining, and slide review. The pathologist will review the slides and report their findings.
My name is Melanie. I am a medical device reprocessing technician. In general, my work starts when I receive a list of items needed for the patient. This is called a pick list. For every pick list generated, we must follow specific instructions provided to us. We must know the patient's name and the surgical procedure being done. A technician in the sterile storage area initiates the process of collecting the items identified on the pick list. Each surgical case will have a different list of items that are required. In this case, the pick list and cart required is for a C-section. The items were found or picked and placed into an enclosed stainless steel cart along with gowns for the surgeon and patient and a basic utensil pack for the procedure. The enclosed cart ensures all the surgical instruments needed for the procedure will remain sterile. All respiratory equipment provided to the operating room is also prepared by the Medical Device Reprocessing Department, or MDRD. Once the case cart is ready for the procedure, it's parked in the department waiting area, where it will be picked up by a porter and brought to the OR. If a dedicated lift is available, a technician will use it to send the cart directly to the OR. The sterility of the items depends on the condition of the package. An item can remain sterile until there's a contaminating event, which is usually caused by moisture, dust, or damage to an item. After the equipment has been used, it is sent into the same enclosed case cart through a dedicated dirty lift. In some cases, a porter brings the cart into the decontamination area for reprocessing.
My name is Blake, and I am a health information management specialist. My role is to make sure important health information is provided directly to the people who need it, and nobody else. This helps us manage the information that reaches all the different people involved in patient care. After a patient discharge in an acute setting, the health information management specialist collects and reviews the data and information from the patient's record. We then use an internationally recognized coding system to convert all the data and information into codes that doctors use to complete diagnoses. The codes are also part of a Canadian system for procedures. For Tabitha, we use diagnosis codes for multiple pregnancy, preterm labor and delivery, prolonged labor, and the immediate postpartum hemorrhage. Procedure codes were added for the C-section and to capture the anesthetic type and the transfusion. As we do with all patients, that information was submitted to the Canadian Institute for Health Information to be used for national comparison, research, and tracking of national health indicators. If there are questions around the increased length of stay of new mothers in hospital, the Hospital Health Authority, along with relevant partners, may request specific data on the number of multiple births that occur over the past 5 years. For patients like Tabitha who are having a multiple gestation pregnancy, a health information management professional working in a data analyst role creates that specific query and pulls data for delivery patient service with the appropriate diagnosis code. They also create a dashboard of current data, as well as data for the last 5 years to create a summary graph comparing the length of stay for patients. We also have to consider the possibility of a lawsuit if a pregnancy doesn't go as planned. In these cases, a health information management professional in an access and disclosure role reviews the patient chart to make sure third-party references are removed. This has to be done before any information is shared. In accordance with the Health Information Act, that individual also has to make sure the lawyer only has access to allowable information that is related specifically to the request and the patient encounter. Once all that is complete, the necessary documents are printed, communications are finalized, and the lawyer is billed within 30 days of the request.
As you can see, I interacted with many health professions throughout my pregnancy. It is great to see how these professions work together to ensure that my babies and I get the best care possible.